The next question from Bashir Ahmad from Pakistan. Assalamu alaikum, sir. Wa alaikum salam. I am performing my duty as a staff nurse at a government hospital. During my medical examination, there was no eye examination. My eyesight is weak. So is it jaiz, is it permitted and halal for me to continue my duty and draw salary? I can perform routine tasks as IV, that's intravenous, cannulation, that is putting a cannula, medication, etc. Bashir Ahmed from Pakistan asked the question that during his exam, during his test, there was no eye examination, but he knew that his eyesight was weak. So is it permitted for him to continue doing the job of a staff nurse, a male nurse? But he says that he can do the normal routine works of giving an IV, intravenous injection, doing cannulization, putting a cannula or medication. So is it permitted? But naturally, for a nurse or for most of the jobs, it's preferable to have good eyesight. Some jobs, it is a must. For example, a pilot. So if you do not tell someone that your eyesight is weak, and if you're a pilot, then I would say it's haram, because for a pilot, the eyesight has to be good, it's a must. But for a staff nurse, it's preferable, it's not a must. You said your eye is weak. You didn't mention what was the weakness. Maybe you are myopic, that means you're short-sighted. That means you can see things, you cannot see things very clearly which are far away, but you can see things which are close by, so it will not be a hindrance at all. Even if it is, you can wear spectacles, or you may be hyperopia, hyperopic. That is, you are short-sighted. That means you can see, sorry, you may be far-sighted. That means you can see close things, but you cannot see far things. Myopic, it's short-sighted, you cannot see far, but can see close. Hyperopia is known as far-sighted. That means you cannot see things which are close. In this case also, you can wear spectacles, no problem. So I feel there's no problem at all. And as you said, you can do your normal duty very well. I don't know whether your eye is weak, you have got glaucoma, whatever thing you may have, if it's causing you obstruction in doing your duty as a male nurse. But we said very clearly that you can give intravenous injection very well, there's no problem at all. You can do cannulization very well, you can give medication very well. So I think there is no problem at all. You can continue with the job. It's totally halal. In future, if you feel you have certain problems, whether it be eye problem or nose problem or ear problem, etc., which is difficult for you to do your duty, especially because you are a male nurse and you may not be able to treat your patients very well, that's the time maybe you become old, you will have to resign. But in this case, when you said you can do it very well, there's no problem at all. Your work is halal, your salary is halal, and may Allah give you more and more health, inshallah.